get stiff and creaky as we age.
But walking helps, and to make it a daily habit, sometimes you just need a little encouragement. Today on Across the Fence, we're learning about a state program you can enroll in right now to help give you the push you need. So get those boots on and let's get walking.
Hello, Vermont. 3 years ago, when my guest heard that Vermont's Department of Health received a grant from the CDC to help combat high rates of disability from arthritis among Vermonters, she thought, I bet UVM could help. And UVM's Walk with Ease program was born. Dr. Karen Westervelt has been a licensed physical therapist for 30 years, and she's the education director for the UVM Osher Center for Integrative Health. As a clinical associate professor in the Department of Rehabilitation and Movement Science at UVM, she's training the next generation of physical therapists, including my second guest today, Peter Wolosinski, a second-year DPT graduate student currently enrolled in Dr. Westervelt's Health Promotion Service Learning class. He has an undergraduate degree in health science, and, spoiler alert, Peter could become your walking coach. So, Dr. Westervelt and Peter, thank you so much for joining me. It's great to have you here this morning.
Yeah, thank you very much.
Yeah,
thank you.
You were on the show back earlier, April 2025. You were on with Suzanne Kelly from the State Department of Health in Vermont. I was rewatching the episode. 40% of Vermonters over 40 have arthritis. That was a wow number. Is arthritis that prevalent?
Yes, arthritis unfortunately is very prevalent. It is the actual #1 cause of disability in the state of Vermont.
Wow, that's shocking. And so arthritis, tell us a little bit more about it. Other than, so there's risk factors for getting arthritis, but what is arthritis? There's also lots of different forms of arthritis.
You're right. So arthritis is a term that probably encompasses about 100 different types of conditions that affect the joints. So the one we're going to be talking about today, and that I'll talk about mostly, is osteoarthritis. And this is damage to the articular cartilage in the joints that usually results in a painful joint. Can have stiffness in the joint. There can be some swelling, and it can often cause people to slow down and be less active.
Yeah, which is the main issue when we're especially what we're going to be talking about today is about that slowing down and the lack of mobility. Well, and I had another question. So it sounds like you don't have to have arthritis to have joint pain. It's a chicken and egg.
True. Any injury can cause joint pain. But arthritis usually develops over time.
Arthritis usually develops over time. But you don't. So if I have joint pain, if I have creaky knees, if I've got a stiff shoulder, it doesn't necessarily mean I have arthritis. It also just might mean that I've got some creakiness with age.
That's true.
Why do our joints get so much stiffer as we age?
The changes in the connective tissues at the joint do change as we age, and but we can make a difference about that by staying physically active.
Right. And so this is my next question. So I'm coming at you, Peter, already. So I'm a runner, and people used to say, about things like running, that you should be careful that you don't wear out your knees. Is that good advice, or is that not the way that we think about motion and activity any longer? Would you ever say that to someone?
You're exactly right. That's not the way we think about motion and activity any longer. Studies show that older adults that run actually have thicker and healthier cartilage in their knees than younger adults that are less active. So running can be a really great way to stay healthy, stay active, as long as you don't have any of the risk factors. Then it's a very healthy thing.
Tell me some more about the risk factors. So then what are the risk factors for arthritis? Or developing arthritis?
There are a number of risk factors. The most common is injury to the joint. So, but not just a little injury, but a traumatic injury like a ligament injury, a significant fracture, a surgery, that can predispose somebody to early onset arthritis. So can obesity. So can poor joint alignment.
What does that mean, poor joint alignment?
Some people just look to see is a joint aligned in a pretty optimal setting or position, and if it's not, then it can put more wear and tear on one end side of the joint versus the other.
So is that, like, for example, I've been told by, I don't know if any of you have ever to a chiropractor, but I was told by a chiropractor that I carry one hip slightly higher than the other. Is that misalignment, or is that just, say, poor habits accumulating over time? Or does it make a difference?
I would say that is not, and correct me if I'm wrong, but that's not the level of misalignment that would be causative factor for arthritis.
Okay.
Lots of people have small misalignments.
Okay.
Yeah.
See, this is where you're now getting the sense that Amy sometimes uses these interviews as an opportunity to ask all of her medical questions. To be like, okay, just real fast, I just want to ask you this one other quick thing. But, well, that's good. Okay, well, so let's now talk a little bit about the Walk with Ease program, because Walk with Ease, that's the intention behind it, right? Is, as we've said, or as you've said, motion is good. We want to be active in order to prevent these types of debilitating conditions that so many Vermonters are suffering from. So it's a national program, and then UVM is offering like an enhancement to give it a little boost. Do you want to tell us about what UVM is doing?
I'd be happy to.
Okay.
So if I back up just a little bit,
Okay.
The state of Vermont Department of Health received a grant, and we're 3 years into a 5-year grant right now. And the purpose of that grant is to get more programming for people with arthritis in our state, so that there are opportunities for people in all corners of the state to be involved in free activity, physical activity programming.
Okay. Okay.
And then the other part of that grant, which was where we also pull Peter in here too, is to help providers, healthcare providers, to know where these programs are, know that they're evidence-based, and that they'll help their patients, that they refer their patients to these community programs.
Okay. So raising awareness.
Exactly.
And then also making certain we've got lots of distribution across the state for lots of different types of programs to help people out.
Right.
Okay.
So that's where the University of Vermont program comes into play. So we started a little over a year ago now, a Walk with Ease program. And the Walk with Ease program is a evidence-based program for people who want to walk more. They don't necessarily have to have arthritis.
Okay.
But they do
Just have that stiff joint, right?
Yes,
a little joint pain.
yes,
Okay.
and maybe not being as physically active as they want to, and the desire to be more physically active.
Okay.
So the Walk with Ease program is a 6-week program where people walk, they set their own goals, but walk about 3 times a week or more, and get support along the way doing the program.
Support along the way. Now this, Peter, I think is where you come in,
Yeah.
right? Because you're not going to be like anybody's walking buddy. Unfortunately, you can't go to the Northeast Kingdom today and then go down to Bristol tomorrow. And
It would be fun, but no, yeah.
It would be fun, but no. So how are you going to be interacting then with folks in the Walk with Ease program?
Yeah, so we're offering people the opportunity to work with a student coach. These are people like myself or my classmates, and we're just going to be able to provide support, answer questions, give flexibility and strength exercises as well. And this is just an option that people can select, but we will communicate once a week for the 6 weeks of the program.
And how will you be reaching out? You said
Phone
emails,
call,
phone
email.
call, okay.
Yeah.
So that's nice. So you can even develop a bit of a relationship.
Yeah, exactly.
Well, and that is something, if I understand, that you're learning how to do as part of this service learning class. Is that right?
Yes.
Yes. So do you want to tell us a little bit about like what the students are learning about how to provide this kind of coaching?
Yes. So in Peter's health promotion class, the students are learning health coaching skills, which basically, to break that down, is how do I help somebody to make and sustain a healthy behavior change? Because many of us know, like, I'd like to walk more, but it's actually hard to get going and get that to become a habit.
Yes, that's the hardest part. We know what we should do, we just don't do it.
You got it. So, so I'm teaching Peter and his classmates strategies for motivational interviewing. How do I help a community member to find that motivation to start that walking program, and then how do we help them to maintain that even once the program ends?
Right, because the 6 weeks is a good time to establish the habit, but we want them to keep going too.
Exactly.
Well, let's talk about who can enroll in the enhanced program, and I think we have a graphic here too about enrolling in it. So who can enroll?
The program is open to any Vermonter, and it is free.
Okay.
We are looking for people who want to walk more, and we're looking for somebody who can stand 10 minutes. Those are really the only criteria. And it's okay if somebody uses a cane or a walker, that's just fine.
Okay, and then when does the coaching start and when will it end? You said it's 6 weeks, so tell us about when it starts.
So it starts the first week.
Yeah.
First week of February? Or first week of?
Yeah, so it starts the first week of the 6-week program, and then I'll just be able to communicate throughout. The program is going on throughout the year, but we're only able to help out during the semester.
Yeah. Right, because we're coming up against the end of the school year. Okay, so if people at home are watching, this is something though that they can enroll in right now, and the program is going to be starting
It's an open.
shortly?
Well, it's an open enrollment.
It's an open enrollment.
We'll accept it. Somebody can go on to the University of Vermont site.
Okay.
They can register for the program. They can select, I'd like to work with a student.
Okay.
If it's the now, if it's the spring semester or the fall semester, we have healthcare provider students who are there to coach and guide somebody through the program.
Okay.
If it's a different time of year and we don't have a class of students, the program continues with the open registration, and people are simply doing the Walk With Ease program with a weekly encouraging email from me.
Oh, good. Okay, so if you don't want to work with a coach, you can still enroll in the program. Okay, so there is no limitations. Anybody who is at home right now who is thinking to themselves, I could use a little encouragement, I can use some help with some habit building, great program for you. Go ahead, and again, we're going to show the graphic here in a second too that shows the enrollment information so that people can go ahead and get signed up into the program. Peter, why is it important to you to do this kind of work?
Yeah, it's really important to me because as a PT student, we learn a lot about promoting health in the clinic, but I think it's also equally, if not more important, to promote health at the community level as well. It also gives us great practice with motivational interviewing, like Dr. Westervelt was saying, and then it gives us experience learning about different community programs so that when we are licensed providers, we can refer out and give advice.
Have you had a lot of experience yet working with clients and patients?
I have had an 8-week program, or 8-week clinical rotation so far, yeah.
Okay. Are you looking forward to doing this program?
Yeah, I am. It'll be fun, yeah.
What is going to be your top tip for how to people to stay motivated?
Ooh, top tip for staying motivated. I think having a routine is really important. So if you have a specific day or even just a group of people that you like to walk with and you all walk together, I think that would be really helpful.
Oh yeah, that's, I think, in general, great advice, right? Make it a routine. A routine and a habit are practically the same thing. Okay, well, one more look at the information about how to enroll in UVM's Walk With Ease enhanced program. And can they request you now, Peter, now that we're all friends?
I'll work with as many people as I can, but we also have a lot of great classmates that are willing to help out. They're awesome. So,
absolutely. Yeah. Okay. Well, Dr. Westervelt and Peter, thank you so much for coming. And as always, Vermont, thank you for learning and exploring with me today. And thanks to the team that makes Across the Fence possible. I'm Amy Finley. This is Across the Fence. Come back and let's learn and explore again tomorrow.